Hello, 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 folks. Welcome. Let's let people kind of get here. Um, I am so glad that y'all are here. This is one of the spaces where, listen, caregivers, the people who take care of our trans, non-binary, and gender diverse people, y'all, special place in my heart. Okay. So if you're here, I know you're here for a reason. You want some tips, you want some tools, maybe you want some support. I'm not gonna get too much into it because I want people to have time to join us on the live, on the webinar. But this is the third part. So we've been doing this. This is the third part. And if you have specific questions on like pre-op, post-op, things like that, we did a general kind of 101 on terms and pronouns already. So if you missed that, definitely drop 101 in the chat for me, and we can make sure that you get the link to watch that replay. Okay. If you missed the pre-op, okay, that was the next one we did. We did a pre-op just talking about binding, tucking. We talked about different hormones, things to look for. If you didn't get that, drop pre-op in the chat and we'll make sure you get the link for that. And then now you're here. Okay. Listen, I think I've given people enough time. They've given them all the time. All right. If they can't show up on time, just kidding. It's fine. We love you. That's what the replay is for. But this specific webinar is one, like I said, near and dear to my heart, because when we look at the trans non-binary community, the focus, as it should be, is a lot on the person who is going through the process, the person who is affirming who they are. And that's a very important stage for them. However, any good affirming care comes with someone who's behind them, who is supporting them, who is giving them love and attention and just support in all that they're doing. And those are the people that I will be speaking to tonight. Now, if you are a trans individual or someone who has gone through affirming surgeries, procedures, and things like that, and you want some information to give to your caregiver or to appreciate them, there's a little bit of that in here too, because frankly, the attention for the caregiver gets lost. And, I have many disclaimers. This is going to be one of them. But one of the things that I know from my experiences, we'll talk a little bit more about that too, is that the caregiver sometimes gets left behind in the shadow of the person who is affirming who they are. Okay. And that's not to say that they need a huge spotlight. That's not to say that even the trans individual wants a huge spotlight, but what the caregiver may be going through gets overshadowed sometimes. So this is a space for you to be seen as a caregiver that you are, as a support person that you are, as the caretaker, the person who builds up that person in your life. This is your space. Okay. And if you have a person in your life who is like that, this is your time to understand what they might feel, what they might need, and just kind of step in and give them some support too. Okay. All right. I've babbled on enough, but that's what we're doing tonight. We're talking about pelvic health, physical therapy related to the caregivers for trans health. Here we go. Okay. We'll see how well technology wants to work with me tonight. It does what it wants to do. Oh, there it is. Okay, so our table of contents, I love to give you a little roadmap of what we're going to do. Okay, I'm going to introduce myself, just a little bit about me, because hi. We're going to talk about some different types of caregivers, right? Because I think some of us think of, oh, the spouse or the parent, but there's some different types of caregivers out there. So where do you fall in, right? What is the role of a caregiver? There's so many different roles that you can have, but what is the role of a caregiver? And what's right for you? And then, hey, I told you, this is a space for the caregivers to take care of themselves. So what does that self-care look like? Like, what are you doing to build up yourself? Ways to take care of you as a caregiver so that you can pour out. Okay. Anyway, we'll get there. And then, of course, appreciation for your caregiver. Okay. Because there is nothing like having someone behind you who is, you can fall on them, but they don't know how much you appreciate that aspect. Okay. So appreciation is key, y'all. So we're going to talk through some of that. All right. See, I told you I have many disclaimers. This is one of them. This information It is not medical advice. Though I am a doctor of physical therapy, this information is purely educational. So if any of this, resonates with you, you feel like you want to go off and use it, or you think something that'd be appropriate for a person that you know, go talk to your provider. Unless I am your provider, we have spoken about this being something that is appropriate for you, I cannot say that that's something that's appropriate for you. So little disclaimer there, but hi. I am Dr. Sha'Rose Arian. I go by Dr. Sha'Rose, and I am a pelvic floor physiotherapist, also known as physical therapist. I am an Australian trained physio, meaning in theory, the university that I went to, we use a lot of New Zealand, Australian based concepts. And also through my 2-month internship in Australia, Queensland, Australia, working one-on-one with the physiotherapist. I use a lot of manual therapy, my hands, I talk with them. I do a lot of stuff like that. So that's who I am. And I'm your pelvic ally. So I am your ally from your pelvic floor to your hips, back, abdomen, everything in and around in between. Okay. I am the owner of Rose Pelvic Physiotherapy located in downtown Huntsville, where we treat folks in person, but also we treat folks virtually. Okay. So if you're not here, I can work with you. If you are here, I can work with you. I can work with you. Right? Or someone that you love or that you take care of, right? And my biggest goal in putting together this webinar, but then the other webinars that I put together also, is to create a safe and affirming environment. Frankly, we just want people to have the educated information and know what they're asking for, what they deserve, but also feel safe in being able to do that. So that's a little bit about me. I am a mom of 2, 6-year-old and 3-year-olds, and a wife, and I am a bisexual woman and loved one of a transgender person. So when I speak to these things, when I speak to being a caregiver, when I speak to, the experiences I've seen, I'm not only going from my personal life experience, I'm also going from my clinical experience, as well as my, researched and educated experience. So bringing that all together to put this in place for y'all. That's a little bit about me. Please share in the chat, if you're comfortable, of course, a little bit about yourself or what brought you here. I will have another disclaimer in a second, but not necessarily who brought you here, but what brought you here. Okay, because this is about you, the caregiver. Or if you are a trans individual, non-binary person, someone receiving affirming care, you can also put, what brought you here as well. I just want to know who's in the room with us, okay? But that's a little bit about me, okay? Now it's going to be about you or the caregiver that you know. So that other disclaimer that I was talking about, this is not a space for us to out any person, okay? As caregivers, we sometimes, right, can put a lot on ourselves. And when you do that, you can sometimes feel lonely in that. But this is not a space for us to out anyone who's not wanting it. So unless you have permission from the person that you are a caregiver for or that you care for to share their story, that is not what we're going to do here today. You can share who you are and what you need without outing or without, sharing somebody else's story. So this is a very safe place, but we want to make sure that the folks that we love and take care of feel safe too. Okay. But when we're looking at this, there are different types of caregivers. So the differences in those, and we'll talk a little bit about each one of them. If you have any questions, if you have any suggestions, anything you want to share, please put it in the chat. I absolutely love just the back and forth, and I need a little bit of the energy. Give it to me, okay? So types of caregiver, right? We have home health, okay? So these are people who are trained, like nurses or social workers, home health aides, physical therapists, can be home health therapists as well. And they provide that medical care and assistance with daily activities, but they do it in your home or in the person's home. There are companies and organizations out there who can help people with that, but home health is a type of caregiving. I like home health, and when I very first started my company, I started in a home-based setting. So I would travel to people and work in their homes. And I loved it because I could truly see you in your environment. Like you can hide things. I mean, you could, but like you can hide the stairs that you go up and down every day, right? And so when I would see people's homes, I could truly, come up with a good plan of care that was going to be good for their environment. Because I could have, had them come to my office and we could have worked every day on things. And if I had not ever asked if they had stairs in their house, I wouldn't have been able to prepare them to climb stairs at some point after a surgery or a big event, right? So I love our home health caretakers. They're awesome. Then we have family and friends, which I will say is probably a majority of where either folks tonight will fall into or the most people that I interact with. They fall into that family kind of friend space, but they're a caregiver. So these are individuals who provide care for a loved one. So think of like a spouse, adult children, or younger children, right? Siblings. Think of maybe even aunt, uncle, grandparents, right? Caregivers come in very many ages, right? And so tonight we're talking about trans health, but I'm in the age group where caregiving for me could even be my grandparent or even my mom or my dad. Okay. So caregivers come in all different ages and we don't want to forget that, but you provide emotional and physical support with them with daily activities. Now, this is going to look a little bit different. So if you're lucky enough to have an occupational therapist, physical therapist, other type of therapist who is a family or friend who can provide care, then you are one lucky person. Okay. That's how I feel about the person in my life. But most people don't have that medical background. And so your role in how you support that person can be pretty different. Okay. But family and friends are a type of caregiver. Then we go into volunteers. So these are people who they provide care without expecting payment, right? They volunteer in the hospital or in communities. They can provide emotional support, run errands, assist with daily activities. So now I would say there are volunteers, and then there are people who do the same thing but expect payment. Okay, those two people exist. But for a volunteer, it's usually someone who may be older, who may have a loved one who is trans or going through affirming procedures, and they absolutely understand the impact that not having support around you can be. Because having a caregiver, it's a bit of a privilege. Not everyone who is in this community can have the support of a family or friend, or can afford the support of, say, home health or someone else. So it's truly sometimes a privilege to be able to be supported in this affirming lifestyle that you really deserve. And so volunteers, though, are people who get that. They understand, and they might give you rides to and from appointments, or they might pick you up after a surgery, or they might go get groceries for you. And those people hold a dear, dear place in my heart because that is some true just altruism. All right. And then we have independent, right? So that is someone who is taking care of themselves. And unfortunately, highly unfortunately, that is a larger majority of folks who go through affirming surgeries and procedures. They're actually taking care of themselves after that. And if you've ever been a part of, witnessed, or even seen any type of affirming care, sometimes it can be a little bit more basic, sometimes it can be a little bit more involved. But either way, rest is required. Rest, and it's really hard to take care of yourself when you're trying to sleep, but also stay on your schedule for your medications, for things like that. So, they often use assistive devices and other tools to manage health and independence. And that's true. And they can get a lot of education before they leave their provider. However, I would say the person who's taking care of themselves, those people are the ones that I love to work with because they really have to do it on their own. And there's no one else kind of helping them find the answers and things like that. So these are just a few types of caregivers, right? And I just what do you think about, like, where do you think you kind of fall in it? Are you a family and friend? Like, or do you work in home health? Are you a volunteer? Or are you someone who has had to take care of yourself? through these procedures. I have seen someone in almost every one of these types, and it's tough. It is tough for sure. But yeah, drop for me. Who are you? Are you family and friend, independent, volunteer? Let me know. Okay, so let's talk about the roles, right? The roles of caregivers, right? Um, because there are so many different things that we can help with and kind of work through. And so finding that for yourself is going to be important. All right. So, of all this, the primary goal of a caregiver is to assist the patient through the recovery process. Now, hear me out. If you're like, what could the recovery look like? Like, what type of surgeries and things like that? If you want like a little bit more in depth into helping folks with maybe their medications or pre-op or post-op, those are those different webinars that I have. That's where you need to go to. So stay here, don't go anywhere. And go check out and get the links for the replay, because those go through surgeries, hormones, all of that. And so this is specifically about, how you can help around that. But if you're unsure of different types of surgeries and things like that, definitely go watch those too. All right. I know I just talk a lot about trans health. Trans health? I do. And because it's important and no one else is really doing it in the space where we're providing this education to you. So anyway, all that to say, the primary goal, right? We want to assist the people through recovery. So what could this look like? All right, it could look like daily activities. So if you think of like a top surgery, bottom surgery, standing, sitting, walking, those are really important things to try to get back to doing in a normal kind of way. And if you're adding tissue to the chest, right, your body gravity, center of gravity is going to be a little bit different. Same way as if you're removing tissue from the chest, if we're talking about top surgery, then you're going to be moving a little bit differently. So being able to push yourself up might not be as comfortable as it used to be. You might need a little bit of a support from the back to help you, right? Using the bathroom, right? That's not just for bottom surgeries, but even for top surgery, because using those anesthesia and things like that, there are some concerns that happen with constipation. So being able to help someone after a procedure or surgery where you're like, okay, we're going to use a stool to help you with this because that's going to be better for you than for you to just sit here and try to push and push. Or, let's make sure you have enough water intake so that your stool can soften up, and make sure you're taking your stool softeners, right? So you become that person with these daily activities that you're helping them through. Hygiene is a big one. Okay. So with hygiene, it's not just, I think initially we think, let's help them shower. Let's help them, sponge bath, bathe. But really hygiene goes to, can they brush their hair? Can they comb their hair? Can they brush their teeth? Wiping under armpits. Hygiene is the quickest way for someone to feel normal again, or just like human, or just not stink, after any type of procedure or surgery. Making appointments, right? Because you're now the one who is in charge of the calendar and the schedule. So when is their next follow-up appointment? What do they need to have in that appointment? Do they need to schedule an appointment with their primary care? If they've traveled to get any type of care. Those are things that you are now going to be responsible for, or, can help with. And then household upkeep. So not only is it you're helping their body recover, but you also don't want laundry to pile up, because what are they going to wear if they've only gotten maybe a couple things that they can fit right now? Or, you don't want dishes to pile up, because that's just gross. My personal opinion there. So you become not only the caregiver for the person, but maybe for their house or apartment, or just if they have any pets, right? Are you taking care of their pets in order for them to be able to travel and get care? So what role can you play in their daily activity? The other side of that is medical assistance. So like changing out dressings. That can be a huge part, especially depending on the location. So if we're thinking about like bottom surgery, which, and then let's say transmasculine bottom surgery, right? There's phalloplasty. Again, if you don't know these words, please, please, please get the replays from the other webinars. But transmasculine phalloplasty, there may be a donor site. So there's not only one area that you need to worry about changing out dressings, there's potentially 3, okay, or more. And so that can be really challenging for someone to do on their own, and knowing which type of dressing to put where, knowing what type of cleaning you might need to do to it is huge. And then, of course, medicine administration. So there's a time for a schedule for all those medications. So, maybe every 4 to 6 hours is the pain medicine. Maybe every 6 to 8 hours is the muscle relaxer. Maybe every, 2 to 3 hours is something else. So helping the person to organize that when everything is still can be chaotic will be a huge role that you play. And then emotional support. And let me tell you this, emotional support emotional support started the moment that person shared with you or expressed to you or asked you to be there for them. Emotional support, it started that moment, right? But it had to have started maybe even before that, because they felt safe and comfortable asking you to be that person. So this is the heaviest part of being a caregiver, is that emotional support. Because affirming care is quite the mental marathon, really, for the person who's going through it, let alone the person who has to watch them go through it. So I like to share this because honestly, I've had 2 kids, like I shared earlier, and my husband, he supported me and helped me through both of those deliveries. And frankly, I think he had the hardest job in that room, because I was prepared. I could be as prepared as I could be, all the courses, classes, education, and everything like that. However, he, on the other end, had to be the caregiver to watch someone go through pain and discomfort and, fear, right? All the things that can happen during that time. So being a caregiver, providing that emotional support, I think can sometimes be the hardest part of being a caregiver. But what might that look like? Preventing loneliness is one of them. Offering a listening ear, but then also just affirming someone. So sometimes just being there and affirming that, yeah, what you're feeling is valid. Even though it is, sometimes people need to hear it. So that emotional support is huge. Okay, let's see. We have a question. How can caregivers best prepare themselves for assisting a transgender individual through gender affirming surgery? Okay, this is good, because just talking about that emotional support, the best way for a caregiver to prepare themselves, right, is for you to be concerned about your own emotional, support. Look in this room, and if you are comfortable or wanting or needing some support outside of it, just put me in the chat, and those people who see me connect with each other, okay? Because y'all are here for a reason. And emotionally, being a caregiver for someone can take a really big weight onto you. So the best way for you to prepare yourself in order to assist someone through gender affirming surgery, one, is to be educated on the surgery, right? Taking these webinars and listening to them is a great start, but also being more specifically aware of what, particular surgery that they're going to have. Also, being aware of another way to take care of yourself, right, is to prepare yourself, is for you to speak directly with the person that you're going to support. Ask them, what do you need from me? What don't you need from me? If you don't know, are you flexible with us figuring this out together? Are you expecting me to be there when you wake up? being very specific, and it seems very dramatic, but when you don't say things and maybe you have an expectation of your role and that person has an expectation of your role and they don't connect, that is truly where things can be really detrimental afterwards. So being very clear on even what you can offer. Like, well, I can't be there for the full 5 days you might be hospitalized, but I could be there for 2. Is there any time in the beginning or the ending that you would prefer me to be there? Right? So taking care and preparing yourself is being prepared for the steps that might be involved in it. So knowing what type of materials will they need for recovery, right? That way, yeah, you can go get them during their surgery, or you can get them beforehand, or you can have them ready for them. But that preparation, okay? The other side of it is knowing what the other side looks like, right? What does it look like after gender affirming surgery? Like, how long do you need to not, lift your arms? How long do you need to use a catheter? How long do you need to fill in the blank, right? Knowing what the other side of it looks like, that is the best way to prepare yourself for assisting someone, because this is a process, this is a marathon, and frankly, there may not be a finish line per se, um, in the sense of like the support that you provide for your person may go on, indefinitely. However, being prepared for that and saying, this is what I can do, this is what I can't do. So educating yourself on yourself, right? On what you're comfortable with, what you're not comfortable with. But then also being open to talking to your person about that, and then even helping them find a solution if you're not, the one to be able to help them with a particular thing. So I think that's the best way. But ultimately, having a mental health provider, I'm gonna always, I will, I love definites. Okay, always, never, forever, love them. However, I'm going to always recommend a psychiatrist, psychologist, because your mental health is so important, and you don't want to get wrapped up in the person that you're taking care of so much that you don't consider yourself in a situation. Okay, it can be selfish. Selfish is not a derogatory word to me. Selfish is something that we all deserve. However, being sure that you can mentally be there and support someone only helps you support them in the way that they need. So mental health provider is probably like my step one to being able to prepare for someone having and supporting them through gender affirming surgery. So let's see, where else? Okay, so we do have some tips for caregivers, and okay, we have another question. How can caregivers assist with emotional support for transgender individuals undergoing hormone therapy or surgery? Oh, okay. I think I kind of answered that a little bit though. So assist with emotional support, right? Important to understand that you cannot, nor should you, be the only person that someone is getting emotional support from. Okay. And I know sometimes we like to feel like we should be, or we can be, and we can be in times. Like, I'm not saying that you should not always be that person, but there should be, because we can't be everything to everyone. We can't give someone everything that they need. It's a big task to ask one person to do that. So if you feel like someone is asking you that, you might really need to evaluate, can you really provide that? Or does that person need to kind of branch out and maybe find some support somewhere else, right? So that's one thing. But assisting with emotional support for someone undergoing hormone therapy or surgery. So let's start with hormone therapy. One thing that I've seen is that someone undergoing hormone therapy will have their caregiver give them their injections or apply their cream or patch or something like that. And I want to caution you on that, because it could be a bit codependent, yes, but also we are, depending on where the person is, they're an adult, and they can and are responsible for their life and their affirming care. And say you don't give them that injection or hormone therapy, right? It's not fully your responsibility to make sure that they are taking care of themselves. You are there to assist them, but you're not there to do it for them. So I would caution you with something like that. But you can help them create systems so that they can do stuff like that. So if the reason why you may be helping them do their injection is because they always would forget, okay, well, how can we set an alarm that you won't ignore? Or maybe we don't set an alarm. How do we, maybe we buy a bracelet that, gives you that reminder that you can tick off whether, in a month you've done all of your injections that you needed to, right? Getting creative in ways like that to where we can instill the independence in our person without it falling on your shoulders, because you don't ever want to be in the place where, oh no, I missed my injection and it's because of you, right? You don't want to be in that place. Sometimes there can be mismanaged and misplaced emotions when someone is on this affirming care roller coaster, realistically. And you don't want to be on the other end of that, because of really something that isn't your responsibility. So I think I answered that question, right? How can we caregivers assist with emotional support for transgender undergoing hormone therapy? Yeah, so I think the best way to assist them is to encourage them and help them find systems for their emotional support, for their emotional regulation. It's not your responsibility to help someone emotionally regulate, but you can help them find the system that does, right? If they're like, I'm terrified to talk to someone, to talk to and vet out mental health providers. Sure, okay, I'll create a list for you and I'll, give them a call and I'll talk to them and ask them the questions. And then here's your spreadsheet on the people that I've talked to. And now you can just pick one of them. But I'm not going to be the one to sit with you in that session necessarily, and do that. So it takes a little bit of time understanding your person, communicating openly with that person, them being willing to communicate openly with you. Now, that you can't control. You cannot control someone communicating openly with you, but you can do the best that you can and be okay with that. And then, of course, for surgeries, I think I touched on that a little bit about how caregivers can assist with emotional support for it, making sure that, that they understand and are prepared for the surgery. Do you know what type of surgery you're having? Do you know what's going to be removed, replaced, augmented? Do you know what these words mean? Do you know what recovery looks like? Helping them to understand those things and advocate for themselves if they need to is super important. So let me know if I didn't answer that question, but I think I did. Okay, so some tips for caregivers. All right, I love this because the biggest thing, like, you want people to feel, we talked about it, you want them to feel human again. So help them feel that way, right? Assist them in brushing their teeth, or assist them in just getting the things for them to do it themselves. Like, here's a cup, here's some water, here's your toothbrush, here's some toothpaste. Now you can you can brush your own teeth, but you've gotten all the tools to do it. You didn't have to get up and do all that stuff, right? Use deodorant, right? First of all, non-deodorant people, I shared this before, but I am a natural deodorant wearer. You can have whatever opinion you want on that, but when I don't wear it, we all know I don't have it on. So we want to just take a wipe and get under the armpits and let them put deodorant on. Feel like themselves again. Brushing their hair, putting it up, just detangling it. Maybe that's a trim for any beard or mustache, right? Feeling just a little less, right? Now, keep in mind that their body just went through some massive surgery or procedure, or it's a change for them. So we want to think of things like dysphoria, right? We don't want to do anything that might increase that. However, we want to be able to make them feel good in wherever they are. Okay. When you feel good and you look good, you are going to heal better. That's just facts. Okay. You want to ensure that patients staying hydrated with plenty of water or Gatorades or clear sodas. Yes, no caffeine, especially when we're talking about recovery. Like, you do not want to be giving people caffeine. Caffeine, one, heart rate goes up, but also affects healing. So making sure they stay hydrated though, because your tissues, we're talking about surgeries, procedures, we're talking about constipation, right? You need a lot of water to kind of flow through the body. One, to plump up tissues, but also to help flush out anesthesia and stuff like that. So your responsibility, right? Help them stay hydrated. If they don't want water, or if they're like NPO, nothing by mouth, give them some ice chips, right? But obviously, again, check with their nurses and things like that. But there's ways, but you are responsible, right, to help them stay hydrated. Give them some Gatorades, maybe some Jello, things like that. Let's see. Ask the patient for what they need. That's the other side of it. Just ask them, hey, do you need me to lift you up a little bit? Or would you like to be up? Do you need another pillow? Would you like another blanket? So some of them may not be as vocal about their needs. And we just assume that they're fine. Now, y'all be honest. Do you have a person in your life? They don't have to be someone that you care for, your loved one. But tell me, if you have someone in your life who's just like, I'm fine, I'm okay. You know who that person is? My husband. My husband is that person for me. I love him dearly. However, he's always fine. And then I do something and he's like, oh, thank you. I didn't know I needed that. Or maybe I did, but I didn't know how to say that. And so if you are feeling maybe they need something, and you ask them and they're like, no, I'm fine. But their neck is kind of like this, right? And you're like, you might be a little bit more comfortable if we just like did this. Sometimes that's appropriate. Okay. So create an open line of communication though. That's the biggest thing. Just being open with one another. It is not easy. I know I'm just throwing this stuff out here like it's just like, whoop. It's not easy. I 100% understand and know that. However, if you don't try or if you don't do it, it just becomes a lot harder. So being open with one another. Okay, let's see. Question. What are some effective pelvic floor exercises for transgender folks recovering from gender affirming surgeries? Ooh, you know what that's a good question for? One of the other webinars that we have. No. In general, I will say just to begin with, some effective pelvic floor exercises is going to be breathing. So very important. It is your job as their caregiver to make sure that they're breathing appropriately, taking big, deep breaths into their chest and, into their belly and abdomen, not just in the chest, because, depending on what kind of surgery or procedure they might have had, it can be really uncomfortable to take that deep breath. And so you really want to encourage, like, okay, breathe down into your stomach. It might hurt a little bit, but just go comfortably, right? One of the things that if someone is overnight in the hospital, so say they had bottom surgery, they're going to see a respiratory therapist who's going to come in with a spirometer, and they're going to be, making sure that they're breathing appropriately. However, they're going to leave that there and tell them, do this every hour. And it's your job to be like, did you do your little breathing treatment? Or getting it for them, because sometimes other nurses and stuff will come in the room and they'll put stuff too far away and your person might not be able to reach it. So it may be your job to make sure, like, hey, I put it here so that it's easy for you to remember that you have to do this in an hour, right? And so I think, some effective exercises, breathing is a big one because so much of it is dependent on it. The other thing is like your feet, right? If they're hospitalized, I say hospitalized because some bottom surgeries require folks to stay for, 5 days or longer. And so you want to make sure they're at least just doing some gentle rocking of their feet, right? Just back and forth, trying to get the blood flow, prevent clots and things like that. Small little leg lifts might be okay. Toe wiggling, right? And then even like a little heel slide. So sliding the heels and kind of bending the knees. Those initially, I think, are really good pelvic floor exercises. And I know you're like, wait a minute, that's not in the pelvic floor. All of it is connected, I promise you. These are ones that we do after most surgeries you want people to do. And it's no different for an affirming surgery. Okay. So let's see. We want to preserve their privacy. If you've ever been in the hospital or, a procedure setting, there is no privacy. They just kind of walk in and they're just like, oh, let's take a look at this today. Or wow, pull down the gown. Some nurses and doctors are better with their bedside manners and asking for permission, and some are really not. So it could be your job to kind of step in and be like, pause. Hi, who are you? Can you introduce yourself? Can you tell us what you're going to do? So you want to preserve their privacy though, because you want to help them again feel like a human and not just like someone who's here and being observed all the time. So you want to listen and understand their needs, but their privacy is too. So that might actually mean for you to step out of the room when they're changing or dressing, right? Or if they're using the bathroom. Respect, dignity, that's what we want. And you might be like, oh my goodness, no, but they need me. They don't if they didn't ask you. They don't need you. They have nurses that can do it. So don't be afraid to call the nurses and say, today, I would like for you to help them go to the bathroom, or I would like for you to do this. Because one, they're there for a reason, and two, depending on if you're a spouse, especially, you want to preserve some of that intimacy for yourselves and things like that later. If you're a parent, that can be awkward too, right? Do you want your kid to show you everything, right? So being aware that that privacy goes for both of you, right? Just like you want a door closed when you go to the bathroom, maybe you do. I'm not that person. I'm okay with the door being open, but some people like it closed. And you want to be able to give them that, even though they're in this room and they don't necessarily have the same abilities. Okay, let's see. How can caregivers balance providing physical assistance with encouraging independence in trans patients? Okay. How can caregivers balance providing physical assistance with, I think I just covered that. So yes, you do want to help them, obviously, because we don't want folks out here walking more than they should, because walking is good and we want you moving, but we also want you to rest and not overdo it so your body can heal. So being able to, one, not be the person that does that. Ask them if they can get physical therapy in the room with them. And if, physical therapy can walk them and help them be independent for a little bit. And then you're not the person that's saying, no, this is too far, or no, don't get up that way. It's somebody else who does it. You get to be like, oh, yeah, that's wild, huh? I can't believe they said that. But yeah, go ahead and lay back down. I think it's a great idea. But you don't have to be the bad guy. Let me see. How else can we help folks providing physical assistance? Okay, yeah. So allowing them to do as much as possible on their own. But again, I really stress having occupational therapy or physical therapy there to show you how to do it first before you attempt to do it on your own. And I know we have some really independent people out there and you're very knowledgeable. However, I just think having a professional show you, so being able to say, all right, we're going to lean a little bit here first, and the person can give you a little bit of a rock in their body and then come up, right? And then you can assist them maybe on the side or with a hand on the back. That can go a long way because they've done most of it on their own, but you've still been there to make sure that they were safe. So balancing that physical where you just want to be like, oh no, don't worry, I'll do this for you, and allowing them to do it themselves. Almost, don't get mad at me, but it's like kids, okay? Because how many times have you seen a sibling or a child, your child, sit there and put their shoes on the wrong feet 5 times in a row, but tell you that they had it, they don't need your help, and you just want to be like, if I just did this, we'd be done and we'd be in the car by now. It's the same way. It's the same way. We're going to balance like, okay, physically, I can help you. I could do this. However, I'm going to allow you to do as much as is safe for you to do on your own. And then I'll step in if and when you need me to. So that's how we balance it, is that communication again, though. You really have to be open and honest with each other on expectations and things like that. Okay, listen, y'all still with me? I just need to know. Are y'all still here? Give me a we here if you are. Okay. Now, caregiver self-care. This one, ways to take care of yourself, because I told you, it can be quite exhausting being a caregiver. And you cannot pour from an empty cup. I know we hear it all the time, right? pouring from empty cup. What does that mean? That means you need to fill your cup of joy, your cup of patience, your cup of, hunger. All of that needs to be full before you can pour into anyone else. Okay? Just like on a plane, we hear it all the time. Put your safety mask on before putting the safety mask of somebody else on, right? You cannot sacrifice yourself in order to save somebody else, because if they need you to be there to be able to help them. Right? So this is a big one. Now, what I'm not going to do is tell you go out and get a massage or a foot, get your feet done. I mean, I think those things are great, but that's not realistic self-care sometimes. That's just very one specific type of self-care. So let's get into it. All right. As a caregiver, it's important for you to take care of yourself, right? So when needed, and I did allude to this a little bit, right? Allow the medical staff to do as much work as they can. Okay? Frankly, you're paying them. Somebody's paying them. The insurance is paying them. Someone's being paid to take care of your person. Your job is to make sure that they do it properly, but sometimes it's not your place to take care of them. I know we are like, no, I know what they need. Sure. And sometimes that means that we let the nurses, give them that bath, or we let the nurse go get that sandwich from the cafeteria, right? Give yourself the time to not be a caregiver. Give yourself the time to enjoy this time with this person, because generally, unless you are outside of someone whose job is to literally be a caregiver, you have a different kind of relationship with them that you don't want that to be overshadowed by your caregiving for them. All right? You get me there? Like, you want to be able to say, hey, let's play some cards, right? And let the nurses bring the water. And let the nurses bring you some water. So if they're like, hey, do y'all need anything? Yes, could you grab me a Gatorade? That is okay too. Allow for yourself to be taken care of. That is self-care. Okay? Now, how else? Advocating for your person. That's taking care of yourself, right? Because if they don't have a strong voice, or they're not able to use it, or that you're just always that person that steps in, advocate for them and make sure that they're getting the care they deserve, because then you don't have to do as much of it either. You see? So make sure that person's taken care of helps you be taken care of. And be able to not only advocate for yourself, but advocate for them. Let's see. How can caregivers advocate for the healthcare needs of their person within the medical system? Okay, fair. So how can you? One of those things is being educated. So I ask a lot of questions of my medical professionals, right? And that's because I want them to be confident in what they're telling me. So if you're saying I need this medication, why? How long? And is there another alternative? Okay. So within healthcare, especially with some of the laws and crazy, I try not to use that word, but it's what it is. The bills and things that are coming out, it's becoming a lot harder for, trans folks to be able to get the care and affirming care. So yeah, you really have to advocate being like, yeah, I need this, or they need this, and this is why. So, how to be able to do that within the healthcare needs within the medical system is being educated on what rights they have. So you can say no to just about anything. A medication, a procedure, you can say no. The affirming care provider can choose to listen or not, but you can say no. And so if it's something like, for example, there was a patient who didn't want to use anesthesia, or they wanted to use a different kind of anesthesia. So their concern was having a specific drug. This is a very smart person who understood the drugs that are anesthesia. Okay. That, most of us wouldn't even know, but they did. And so they actually advocated for themselves and were like, please don't use, they talk with the anesthesiologist, don't use this one. Is there another option for you to use? And they went back and forth in their little conversation, but they were able to come to a compromise that they would use a different anesthesia unless the patient's heart rate got too high, and then they'd have to use the other one. And you know what? That was a good compromise, and they advocated, but they didn't know. I wouldn't have known to do that, but they knew to do that because they knew what was best for them, right? I have another example is like a patient didn't want to use morphine. They didn't want to use morphine as a pain medication. And so they were getting a procedure done where they were like, no, morphine is what we use for this. And they were like, I don't want to use it. Give me something else or don't give me it at all. And they decided not to have it at all. How comfortable that procedure was, not sure. But they made that decision. And the people behind them also said, hey, this procedure they're about to take you away to, they use morphine. And that is what prompted the person to be like, I don't want that. And they're like, okay, well, let me get the nurse and you can explain, and then she'll be able to communicate that for you. So really understanding and knowing what's normal, what's not normal, or abnormal, or what things you can say yes and no to. Like, you should not, no person, caregiver or person receiving affirming care should go into any procedure blind, procedure or surgery. You should not go into it blind, just assuming that your provider has your best interest at heart. They do. Hear me out. Your provider does have your best interest at heart. However, they see a lot of people. They do plenty of procedures, but you are the only one who knows your body. You wouldn't be here, right? Your person wouldn't be in this space getting affirming care if they didn't know their body, if they didn't feel like their body wasn't, didn't match or didn't line up with how they felt. So use that same type of understanding to know when to advocate for something. Now, always understand that your provider has the right to say no. They can say, absolutely not, I'm not doing that. And then you might have to find someone else to do it, but they have that right just as much as you have the right to say, I don't want this, or can we do it this way, or is there another option? So that's the biggest thing, is being so knowledgeable on what's happening. And it's sad that we have to do it. However, that's the best way to protect ourselves and our people, is to know, okay, well, this procedure usually has, this removal. Why? Is that something that's necessary? In having them respond to that. So back to some self-care for you. It's okay to take a couple of hours to yourself outside or away from your person. That is huge, right? I told you selfishness. I don't feel like that's a derogatory term. I feel like it's a right to have time alone. And your person might really want some time alone and they just don't know how to ask you. Like, they've asked you to be here to help them and support them. And then they're going to be like, hey, can you just leave me alone for a couple hours? That can sometimes be a hard conversation to have. So you saying, hey, you're all set up. Your meds are all good. I'm going to go take a couple hours to sit wherever. Maybe you're going to sit outside, and you can do whatever you want to do, but you're just taking that time. I'll be back at this time. Give them a realistic time that you're going to be back, and take that time away. Refresh, take a shower, take a bubble bath. I don't know what your self-care looks like, but give yourself the space, because when you're there all the time, it really can become overwhelming. Okay? Go walk. Frankly, that would be a great place to just walk and take care of yourself, get your body moving, get some fresh air, right? Another way to take care of yourself is to sleep outside of the care environment or the hospital. So if your person is staying in the hospital for a few days, don't sleep there every night. Unless you are truly terrified or worried about their care, or you don't feel like it's safe, don't sleep there every night if you don't have to. Or if you, I get sometimes you might not be able to, like, maybe you don't have a hotel or an Airbnb or something like that, but sleep in the car in the parking garage. I don't know, is that safe? Maybe, but find somewhere else to be able to rest. Okay. Again, I understand having a caregiver, being a caregiver can sometimes be a privileged thing, but find somewhere else to sleep, because in the hospital, you do not get sleep. In their room, you might not get sleep because they may be waking and falling asleep at different times. So as long as they're in a place where they're taken care of, or they can take care of themselves, find you somewhere to get a good night's rest. Again, fill your cup. Sleep is a big part of our overall health. And if you're not sleeping, you definitely aren't in a place to be taking care of someone. You don't want to be groggy the next day and maybe you gave them the wrong meds and now they've had too many of the muscle relaxers and they're knocked out, right? We don't want to be in a situation like that. Find somewhere for you to sleep comfortably, right? Um, let's see. Take care of your energy, right? Before you pour back into them. Energy, right? I exude so much energy all the time. Okay. So if I don't have this level of energy, which can sometimes happen, clearly something has happened, right? Clearly I've not been taking care of myself, or I'm not in a place today to deliver it. And so taking care of your energy before you pour back into them, because they want that. They asked you, or you offered, or there's been an understanding that you are the person that's going to take care of them. Bring that energy. They want that. They know that when they come out of a surgery or procedure, that's the face they want to see. And that's the energy like, oh man, you look like crap. Like if that's you, they want that. So be in a place where you can provide it. And if you're not, really evaluate why. Okay. Is it because you didn't get a good night's sleep? Is it because you haven't had breakfast? Is it because, you're thirsty? Right? Let's do our halt, right? Are you hungry, angry, lonely, tired? If you're any of those things, you need to take a second, halt your body, and go fix it. Okay. Let's see. We have another question. What self-care strategies are essential for caregivers to prevent burnout while supporting transgender patients? Ooh. Okay. I would say the strategies are being completely open and honest with what you can and cannot do. Those boundaries have to be very firm. If you're like, I don't change wounds, I don't do blood, that has to be very firm. And you being like, we have to find a different way, because it can easily turn into a situation where you're like, I can't help you anymore because I'm forced to do this thing that my body truly doesn't like. And our bodies do things like that. The other thing that's essential, for you to prevent burnout is to take the time away. I truly used to be that person that was like, I want to live in your skin. Oh my goodness. And now I'm like, oh gosh, please get away from me. And that's not because I've gotten jaded. That's because I've gotten just a little perspective. Okay. When you have children who are like, I want to be in your skin, you realize just how uncomfortable that really can be. But spending all the time with someone all the time is it doesn't give you time to just not be on. It's like if you're at work and then you have to go to an after work function with your coworkers. It's not that you don't like your coworkers, but it's like, I've just been with you for 8 hours today. You want me to spend another 3 hours with you? It's kind of like that. So truly, to prevent burnout, you've got to take time away. You've got to take time for yourself. You've got to, whether that's like, I'm going to read a book, right? I'm going to read a book. That'll give you something to talk about too. Or I'm going to go for a walk. Truly being aware of like, what can I do to take care of myself to fill back into this? Because like I said, affirming care, the transgender, non-binary, gender diverse population, and the affirming care that they seek out sometimes isn't something that is just, you got this procedure and that solves the problem. No, this is a lifelong thing that folks are going to be working through, and you might be by their side doing that. So you don't want to get burnt out in a situation of, I'm so tired of talking about hormones, or I'm just tired of you being the center of attention. That is what this is for. Right now, being this caregiver, knowing that I need attention too, right? Ask for that. Okay? Ask for that. That's the essential strategy. Ask for what you need as well. They might be like, hey, I have this procedure coming up, or hormone therapy, or fluctuation once folks get on hormones is common. But being very clear, and that's cool. We can handle that. And I still need things too. So I'm going to ask for them. And I'm going to ask you to deliver them, or understand that I might, or we can find an alternative of how I can get what I need as well. So I would say that would be the best strategy for preventing burnout, because it's very real. Relationships, relationships on all levels, right? Not just like spouses, but siblings, parents, child. Relationships can go really wrong when that communication and understanding isn't there. But yeah, so but embrace your needs, right? To avoid burnout. That's the biggest thing. How can you take care of yourself? Now, okay, how can you appreciate the caregiver in your life, right? Because it's not that they're here. How can you appreciate them? So offer to help them in the future. You know what I call that? Bartering. Okay, you come help me with this procedure, this surgery, and when you have a baby, or if you have a baby, I'll help you take care of your baby. Just kidding, but I'll bring you, over some funny movies, and we'll watch that while you put your feet up, and we laugh, right? So offer to help in the future, because to just take and take and take and take and take and take from a giver is so common, because givers are givers, right? They give care, they give love, they give attention. And there are people who don't realize that at some point the giver is going to need something. Everyone needs something at some point. So flip the script and take yourself out of the center and truly say, if I was having to help someone through this process, what might I want? What might I need? If you don't want to ask them specifically, I highly encourage you to ask them specifically. But if you don't want to, just take yourself out of the spotlight and say, what could they need? What could they use? Okay. So offer to help them in the future. Share a meal, right? A home cooked meal. Listen, home cook, that's asking a lot for someone like me who can cook. I can cook, but I don't like to. But like, I'll go pick up some kava. So good. Um, so we can share a meal together and not talk about hormone therapy, and not talk about this procedure, and not talk about anything related to being a caregiver. Let's talk about what we saw on TV last night, or so many other things. But let's remove ourselves from those roles and truly connect with each other on the way that you have that relationship in. Encourage them to take self-care. So this is where you, as someone who may be receiving the care, right, who's getting that affirming healthcare, encourage your caregiver to go take a walk. Encourage them to go take a nap. Encourage them to, go shopping if that's their sense of self-care. Or encourage them to call their other friend, and be like, hey, what you been up to? Right? Encourage them to go take care of themselves so that they can take care of you. Right? Insist them in making their job easier. Right? Okay, so listen, some people enjoy being taken care of. I do. I absolutely enjoy it. But don't make it harder than it has to be, right? Like, if you can do something safely, and there's just a matter of like, well, they'll do it for me, do it for yourself, okay? Don't be so independent that it's not safe, but also don't be so dependent that it's not, really caring, okay? Lend a listening ear. That goes, communication is huge on all ends. But if you're willing to listen to them, right? If you're willing to listen to them on what their day might have looked like, what they may be going through, what they're excited for, oh man, it shows them that you truly appreciate them. Okay? Send a handwritten note. I love getting mail. I love getting it. And I love cards. I love pictures. So send a note and just say, hey, thank you. Thank you so much for what you did. It could truly just say, thank you. And I guarantee you I'll be bawling. Like, oh my God, you love me. Just show someone that you care. Invite them to a post-recovery activity. Okay, you got this, procedure or surgery done. You got your mobility back. What are we going to do? Are we going to go bowling? Are we going to go golfing? I don't golf, but are we going to do something together? And let's hang out in a space that's just not even anything about your surgery procedure or anything like that. So let's go do something. Okay. So a little bit of kindness, it goes a long way. People just really want to be appreciated. That's it. You don't have to find this just dramatic show of it. It never really has to be that. It can sometimes just be very simple of like, hey, I appreciate you. I know I might not say that often, but I do. And thank you. And folks love that. Okay. Let's see. We have this question. How can caregivers educate themselves about the specific needs of transgender patients to provide better care? this, right? Being here, this alone, like you're here, you're asking questions, you're listening. Also, my previous webinars and the one that we have coming up next, right? That is ways. WPATH is another good way for you to be able to get educated on it as well. Talking to the doctors around you. So you're going to these appointments, you have these mental health providers, ask them more specific questions on things. Is this normal? Have you seen this before with other people? Have you, fill in the blank? And that can be how you can, educate yourself about the specific needs of the patient, but also ask the person that you're helping. What do you need? How can I help you? Do you understand this? Because I didn't. And being completely open with that, that's a really good way to do it as well. Let's see. Are there any specific resources or support groups available for caregivers of transgender individuals? So, there are. And in the community, just like many other places, it can be a little bit hard to find. So I have been able to witness resources and groups at places like the Black Trans Advocacy Conference. They have a space for spouses to be able to get together and talk. They have a space for parents of transgender individuals to get together and talk. They have a space for parents who are trans, right, to get together and talk. These find communities, find like conferences or organizations, and typically within those organizations there are spaces for caregivers, right? Because it can be lonely. It can be very lonely for you to feel like I'm in this all by myself. No one understands this struggle. Is this normal? I don't get it. Why am I so frustrated with this person? And it really could be that you just don't, there's no one else around you that you're able to talk to. And that's the other side of it. You have to talk to someone. Being very frank and honest with the person that may be trans and saying, look, I won't share your story because it's not mine to share. However, I need to get help, or I need support, or I need to talk to someone that's not you. What are you comfortable with? And let's find a way to do it. And being so okay with that, because it can be very lonely to be in a space where someone may not be open or out, and that's perfectly okay for them to be. However, you're going through this with them. So this is a space where you understand, like, yes, I am your caregiver, or I am your mom or dad or parent or sibling or whomever. And I'm also the person who is watching you go through this, but no one is out there asking me how I'm doing. And that is where you want to find that support group. So WPATH, I think, is a great place. There may be some Facebook groups. I'd be wary of those, be careful. But yeah, any organizations, like I said, Black Trans Advocacy Conference, they have a space for spouses and parents of queer folks, but also queer parents and things like that, to be able to find those resources. But okay, if you have any other questions, please drop them in the chat. Hopefully I've been able to answer so many of your questions as a caregiver. And frankly, I just want to say a big thank you. Thank you, one, for being here tonight and listening to my voice, but also thank you for what you do for your person you care for, right? Thank you for what you do. If no one else has told you, thank you. I appreciate you. I appreciate you being here. I appreciate you learning more for your people. Get those replays. If there was anything that you were like, I don't know, I guarantee I probably covered it in a different webinar. So definitely reach out. If you're someone who could benefit from pelvic floor physical therapy, so if you are a transgender individual, or you know someone who is, and or you have something else that might be going on for the next, I say 24 hours, but it honestly ends up being like 48 hours. I am offering a free consultation for us to sit down and talk about what may be going on. You can, I'll have my assistant drop it right now, the link for you to schedule that, and we'll send the replay out in an email as well as that link as well. So again, thank you so much for being here tonight. You can follow me on Instagram, please. I am your pelvic ally. On Facebook, I am Rose Pelvic Physiotherapy. And then if you have any questions or need any assistance, you can do info@rosepelvicphysio.com. So you let me know if there's any questions. We will get them answered for you. But thank you so much for being here, and you are appreciated, and we really care for you. So y'all have a wonderful night.